Every morning across America, millions of toddlers and young children walk through the doors of preschools and daycare centers. They carry lunchboxes, comfort toys, and dreams of finger painting, snack time, and storybooks. But many also bring something no one sees and no one wants. They bring Group A Streptococcus, the invisible bacteria that causes strep throat. This isn't just a sore throat we're talking about. It's a fast-moving infection that thrives in the very environments where young children gather, tight classrooms, shared toys, and often limited hygiene oversight. In these high-contact settings, strep can spread like wildfire through coughs, sneezes, saliva, even the soft hug of a teddy bear passed from one child to the next. And the scariest part? Most of the time, no one knows it's there until it's too late. For most children, strep starts off quietly a mild sore throat, maybe some fatigue, a little fussiness, but it can escalate rapidly. Within a day or two, the symptoms can intensify: fever, headache, vomiting, painful swallowing, swollen glands in the neck. For some, these symptoms are short-lived, but for others, especially if left untreated, this simple throat infection can lead to scarlet fever, infectious spread to the ears or sinuses, and in the most severe cases, rheumatic heart disease. Lifelong condition caused when the body's own immune system attacks the heart. Yes, you heard that right. Strep throat can damage a child's heart for life. And yet, because young children often don't articulate pain clearly or may not recognize it, all the infection has time to move from one child to another before anyone notices. From teachers, from caregivers. So what should you watch for? Look for red or white patches in the throat. Watch for fever, even mild. Take note if the child is eating less, sleeping more, or saying they don't want to talk. Tender glands under the jaw can be an early warning, and sometimes it shows up with a rash, especially on the chest or back. These aren't just flu symptoms, they could be strep. But here's the harsh truth: by the time symptoms appear, the bacteria may have already made its rounds. That's why the real key isn't just treatment, it's prevention. And prevention starts with simple habits. Wash hands after every cough, every sneeze, every meal, and every trip to the bathroom. Use soap and water, or hand sanitizer if that's all that's available. Wipe down toys every day, especially the ones that end up in little mouths. Teach children to cough into their elbows, not their hands. And most importantly, when a child shows symptoms, let them rest at home. Even one missed day can prevent dozens of other children from getting sick. Now let's talk about treatment. If a child is diagnosed with strep throat, a full course of antibiotics is not optional, it's essential, even if the child seems to feel better after 2 or 3 days. Stopping antibiotics early increases the chance of relapse and spreads the bacteria to others. 10 days is the gold standard. Finish it, always. And don't forget to clean what the child touched: bedding, toys, cups. Wash everything they came in contact with to ensure the bacteria doesn't stick around waiting for the next little hand to touch it. For daycare providers, this is more than a health policy. It's a duty of care. Your vigilance could protect not just the children in your classroom, but their families and your staff. And for parents, your awareness is the first line of defense. Ask questions, advocate for sick day policies, and make sure your child gets tested when they show signs of illness. It's not overreacting, it's responsible parenting. So where do we go from here? We create a culture of protection. In our homes, in our classrooms, in every preschool where tiny shoes line up by the door. Let's stop strep where it starts, in the places where children laugh, learn, and grow. Because protecting children from strep isn't just healthcare, it's childcare.